A couple of key stats that we like to share with you, continue to share with you. Easy visit clicks so far, 4,389, resulting in 650 easy visit screening questionnaires, and 259 of those folks have used the COVID-19 code, which waives their fee. So please keep helping us direct people to that and know that there is an opportunity for this test to be free for them. We have still only tested 21 for COVID-19 at Bryan Medical Center. 20 of those are negative and 1 is still pending. And for our bed count, you'll see some deacceleration happening as we prepare. Again, our bed count, we're licensed for 640 beds. We have 538 active beds, and our midnight census is now at 400. One more thing before I turn it over to everyone. Yesterday, Dr. Dave Myers, our director of our behavioral health services, talked about the importance of structure for our kids and some other helpful hints for the community. Something really cool has kind of happened. You may have seen the news release from the Nebraska State Educational Association and Lincoln Public Schools, where through News Channel Nebraska, they will be delivering curriculum to kids throughout the state, 9 to 11 for elementary kids, and then 1 to 3 for secondary education. It will blanket the state through the Nebraska News Channel network, also through their app and all of their digital channels. What I think is why I'm announcing this is the sponsors of this are going to be the University of Nebraska and Bryan Health. Again, it is so important to bring the structure to your kids' life and get them in a normal routine. And I'm also heartened to see that when you have LPS, Bryan, University of Nebraska, Lincoln is really standing up for the state right now. So with that, I'll turn it over to Dr. John Trapp.
Thank you. So again, lots of preparations going on daily here at Bryan Medical Center. As we review our resources, bed availability, use of personal protective equipment, lots of discussions about elective cases, in conversations with our surgical colleagues, we're already starting to see decelerations in elective cases being done. People are making choices, surgeons are making choices to reduce some of those elective cases that can be delayed for a period of time. I anticipate that we will have further announcements on this as we collaborate with St. Elizabeth's here in Lincoln, Nebraska, as we further discuss this with our surgeons about making a decision later today about where we're going to go with that. So again, great discussion, great collaboration, a lot of discussion ongoing with regard to that. Now, there's lots of questions about testing. That's been a great barrier, if you will, towards really understanding the prevalence of this disorder in our community. Bob mentioned the number of tests that we've already done, a relatively limited number. We'd like to do more, but we're limited with regard to access to reagents and testing supplies. We hope to see an acceleration in that over the next few weeks. Another question that comes up is this disorder in Lincoln? Is COVID-19 present in Lincoln? The general assumption is we believe it's here. There's a delay in symptoms, a delay in presentation, so we're anticipating those cases starting to spike. We've seen cases climb in Omaha. We've seen cases climb in other cities where this starts as a small number and grows rapidly. So in preparation for that, we are preparing through our emergency department, through our hospitalist service, with our surgeons, with our critical care physicians, to get ready for a surge in the near future. And what I mean by that is more patients seeking healthcare assistance with that. Also with that in mind, we have to work together with our community. What can you do to help reduce this? I really think that this is a disorder that the community can have a dramatic effect. They can reduce the significance of this disorder by how we act. I'm going to encourage you to be socially responsible. What I mean by that, do what's recommended. Keep your distance. Wash your hands. If you're sick, stay home. We need you to do that. This is a disease that we can actually control with our social actions.
Thank you, John. Bryan Health and Bryan Medical Center is here to help you through this. we're here every step of the way. We're prepared, and one of the things that you've heard a lot about is social distancing. One aspect of that is how do you receive your medical care? Telemedicine really is at the forefront now in terms of helping us maintain social distancing and helping us keep patients in locations where they can be cared for safely. Bryan Health Easy Visit is one application of telemedicine services that we've offered over the last several years. The statistics in terms of number of patients who are accessing our Easy Visit platform have increased dramatically, and we would encourage that to continue. But Bryan Health Easy Visit can help patients understand what they should do if they feel that they're ill and give some direction in terms of where they can go to have additional answers to their questions. In addition, with the use of a promo code COVID-19, COVID-19, patients can complete a visit free if they simply want additional information. Bryan Health Easy Visit offers board-certified physicians who are available 24 hours a day, 7 days a week, to answer those questions. Some of those questions may be, what do I do if I feel ill, and what do I do at home if I feel ill? And Dr. Clough is here to help answer some of those questions for you.
Thank you, Bryan. I wanted to make the public aware that on the Bryan Health website right now, you can click on experiencing symptoms, and that would take you to a PDF that would work you through if you had mild, moderate, or severe symptoms and what you should do for that. What we are recommending, for instance, if you're a community provider or your physician on the Easy Visit recommended for you to stay home or self-isolate, we would ask that you take your temperature twice a day, drink plenty of fluids, rest, and certainly observe for symptoms that might be more serious, including painful breathing, chest pain, poor color or blueness around your lips, or a severe persistent high fever. If you develop those symptoms, we would want you to reach out to your provider. Once again, we would always want you to call the emergency department or your provider before showing up for evaluation. Again, you can access this PDF on the Bryan Health website, which will help explain and deliver some appropriate education for you for taking care of yourself when you're at home. Thank you.
I'm John Woodrich, CEO of Bryan Medical Center, and I just wanted to give people an update in regards to our Incident Command Center. We continue to operate 24/7. We've stood this center up for a couple of weeks. We're now working on creating teams that will take us through this on the long haul so that we don't get exhausted ourselves. We've got a lot of people stepping to the plate, so we're there to continue to support this community. And you just heard our medical staff is unbelievably engaged in this and helping with the communication that's continuing to go out. We are preparing for a surge because if you just look what's happened in other parts of the country, we want to make sure we're ready for that. We're starting to reach out now to a lot of our rural communities because we want to make sure that we continue to be that support mechanism for them. They've relied on a very strong relationship with Bryan. So we're looking at avenues of telemedicine so we don't have to have people come all the way across the state. How could we manage them in their area? We want to make sure they have the proper amounts of personal protective equipment as well, so we're getting inventories with them. So we will continue to make sure that we're taking care of the folks all the way across Nebraska as we've been looking at taking care of the people here within Lincoln. Most recently, I've personally joined the Unified Command Center at the Health Department. So we make sure that the communication that's going out to our public is in sync and we're in line. And CHI has a representative on that panel as well. So I think this will just help keep the message clear to our community. With that, I would like to open it up to any questions that have been put in through the chat.
So this is really a fluid question. This could really change at any time just based on what's happening in the emergency department. Lots of patients are getting screened and evaluated. At the present time, I believe we have one person in isolation with results pending.
Yes, we've been utilizing our typical vendors in relationship to that, and now we've started to ask that both at a health department and state level. But when they're limited, I think they're being very prudent in assuring that we're going through the appropriate screening. And as stated earlier, you know, we go ahead and we screen these individuals, and a lot of them it's so mild that they can just go to their home and self-isolate. But if we have a person that's been running a temperature and is having breathing issues, they will probably be admitted to our organization and monitored, and at that time we work with the health department to determine if a test is to be run. What we don't want to see happen is just arbitrarily running tests on everybody, because we will just go through those kits very quickly. So I think our coordination with the health department is very vital at this time until we're able to get our hands on more of those kits. I don't have the exact number on this, but this is a collaborative effort as we identify patients that we may have put into the hospital. We have that discussion, and there's basically an algorithm that we go through to assure who needs to be tested, but it's a mutual agreement between working with the health department and the provider. Yes, we're just making sure that our communication and our approach to this is unified. So the reason for making sure we identify what is a true elective case is so that we all follow it appropriately and we don't have confusion. But what is the purpose of this? We want to make sure that we're cognizant of our supplies that we're utilizing, that protective equipment, as well as blood. When you think about that, a lot of folks right now aren't going out and giving blood because they're doing what we told them to do, is to go ahead and stay home. So we have to think about that mechanism as well as we go into the future. You know, if people can wait and have that procedure done, let's just say 90 days from now, we would prefer that we go ahead and hold off and conserve on supplies and on blood. It's almost a day by day as we order additional flu tests. We're getting partial orders in, but right now we're staying ahead of it. And the same thing with our respiratory pathogen panel. It's the reagents in order to run those tests. We get down to low numbers and another shipment comes in. So for now, we're staying fine with those, but we are concerned that if we start to see that surge of could we continue to keep up with the number of tests that need to be done.
At this time this morning, the patient that we are currently waiting for testing is not in critical condition. Obviously, that can change hour by hour, but currently not in critical condition.
I believe that's a very good question and one that we've been diving into right now, because that seems to be the impression, and we want to find out how is Omaha getting access to more of these tests than we're able to here in Lincoln. So right now that is a key topic that we're continuing to investigate. Yes, I would agree. All of these measures that are being taken should have an impact on flattening the curve. And you know, you've probably heard now that the state of California has made it where everybody stays in. And we just want people to listen and do what's best. So the more you can stay kind of isolated and keep that social distancing, I think the likelihood we should be able to flatten this curve.
One of the advantages of Bryan Health Easy Visit is it can be accessed by patients from around the state. So they can receive that information through Bryan Health Easy Visit. They can be directed to the proper locations to receive their information through call lines. So small communities are being supported by Bryan Health really all through this process.
Certainly it's more difficult to identify those patients. Some patients may respond differently socially if they knew that they had the disorder. I think if we were able to get higher numbers and we said more and more people were involved, that may motivate individuals to say, this is real, I need to really self-isolate, I need to follow the directions that I've been instructed or educated to do. Right now, again, because testing is limited, you're going to see that done in more ill patients, hospitalized patients, and that's where we're at right now. One other comment about testing for rural communities. You know, everybody in the state of Nebraska has access to the health board to get testing done. So if other physicians in other communities are going through the same screening process, they are able to get access to that testing as well. And that's another reason why, with the limited capacity, these are spread throughout Nebraska, probably going to more of the metropolitan areas where there's just higher volumes. But the entire state has access to the state board to get this testing done.
So what we're doing is we're working with our vendors on our analyzers. So there's some software changes that need to be made and looking at the right reagents to use appropriately for doing this testing. We're actually working with 3 different vendors right now and pushing as hard as we can. And as soon as we're able to do it, you're going to be the first ones to know.
With a limited supply of testing, we need to rely on symptoms to determine which patients receive the testing. So mild symptoms, temperature less than 100 degrees, and minimal cough, no shortness of breath, those patients will self-isolate, and 80 to 90% of those patients will do well at home. For more severe symptoms, development of chest pain, shortness of breath, confusion, other symptoms like those, then testing will certainly be pursued.
We are looking for it, but with limited tests. We've done just over 20 tests here at Bryan Medical Center. You know, we're just touching the tip of the iceberg here. So I think with more extensive testing, we would identify this earlier. You're right. I mean, Lincoln's a community where there's lots of in and out. Omaha's not that far away. We've had recent events, big public events. So we're going to find this. We assume it's here. That's the basis for my previous comments. I think we have to act like it's here and do all that self-isolation.